Well, according to the CDC, tobacco use remains the nation's leading cause of preventable death.
And today is the Great American Smokeout, a day to encourage smokers to quit. So whether you're trying to kick the habit for yourself or maybe you just want to encourage someone else, family physician Dr. Jennifer Caudle is here this morning with some advice. Dr. Jen, always good to see you.
It's good to see you both.
I hear these days we're talking so much more about opioids, but is tobacco usage still a problem?
It is. It's a big, big problem. We know over 36 million people smoke. It's a big deal. And the thing about it is cancer, one of the major causes of cancer, tobacco contains cancer-causing substances. It's a huge deal. I often tell my patients, if they had to pick one thing to do to literally single-handedly change the course of their life, it would be to quit smoking. That's
and we're not just talking about cigarettes as far as tobacco use.
I'm glad that you talked about that because a lot of products contain tobacco, pipes, cigars. There's also chew, the sort of the chewing tobacco, things like that. These are all problematic. So even if you don't smoke cigarettes, but you use other tobacco-containing products, it's still a problem.
So many people want to quit.
They do.
How do you start? And it's not easy. How do you even start?
I think it's actually one of the hardest things some of my patients have told me they had to do. And I would say for anyone listening out there, if you're getting your kids ready for school or you're getting ready to go to work and you try to quit smoking, etc., don't be discouraged. Set a date and let your family members know that you're trying to quit smoking so they can be ready for that. Remove the reminders of smoking, the ashtrays, throw out the old cigarettes, things like that. Develop a plan because remember, a lot of people smoke when they're drinking or when they're doing other activities. Be prepared for that. Stock up on substitutes. We've got sugarless gum here. We have candy. I don't want you to develop diabetes because we're quitting smoking.
About one vice for another.
Right. But maybe sugarless gum may be the way to go. And a support system. You want a buddy to go through this with, and maybe try to quit smoking with a coworker, etc. Things like this. Remember, there are lots of great options to help us quit. There are a lot of medications, prescription, prescribed medications. There are over-the-counter medications that can help. So we can help you.
Well, my assistant last year, Judy, quit smoking, and because
awesome.
I was on her for years and years. Yeah. But the support is really important. So if someone wants to support someone, what should they do?
I would say the first thing is understand for those who are supporting your family, your friends, your loved ones, this is going to be tough. Yeah. It's tough, okay? So understand that. Be supportive. Go easy. Help them. Encourage them to sort of wash all the reminders of the smoking. Wash clothes that may smell of smoke and things like that. Try not to, if you smoke and you're around someone, well, I want you to quit smoking, but try to avoid smoking or being in smoky areas with that person. The support is really the biggest thing, and understanding what they're going through and really trying to help them accomplish their goal.
Let's say you somehow do it, you quit the habit, the habit, how quickly will you see health benefits?
You know, the health benefits can be seen almost immediately. It's really inspiring. We know that within 20 minutes of quitting smoking, your heart rate and your blood pressure drop. We know that 2 weeks to 3 months, your circulation's getting better, your lung function's getting better, that coughing and shortness of breath, that smoker's cough we often talk about around 1 to 9 months. A year, the excess risk of coronary heart disease is half that of someone who smokes. But we just stopped here on this full screen at a year. The benefits go out 10, 15 years.
Hopefully adding years to your life.
Adding years to your life. The risk of lung cancer is decreased by half that at 10 years out, etc. Honestly, people who don't smoke live longer. The bottom line.
Nothing to be ashamed of because there are a lot of people, celebrities.
Don't be ashamed, but this is the day maybe to quit. So that's what I want to encourage people to do.
Great. Thank you, Dr. Jen, as always.
We'll be right back.
Yeah.